Hello, welcome to this new tutorial presented by the SCHRDbb. Here we're going to visualize the respiratory system examination. For the respiratory system examination, we are going to have examination peripherally and the examination centrally. The central examination is going to be divided into two: anterior chest examination and posterior chest examination. It's always good to finish with all anterior chest and then go to the posterior chest in order to avoid changing position of the patient every time. So we start with the peripheral examination. So for the peripheral examination, we are going to visualize at the level of the nail bed if you see any peripheral sinuses, as blue is discoloration of the skin. The second element you try to visualize if there is any clubbing. And to visualize clubbing, you do the Shamrod test. So come closer. For the Shamrod test, you try to place the finger as such. You see, in this case, you're going to have the formation of a rhombic window in the middle. In the case of clubbing, you're not going to visualize that rhombic window. The next element, after this is particularly for peripheral respiratory system examination. We now start with the anterior chest. And before going to the anterior chest, normally to visualize central sinuses, you have to look at the lips and the tongue of the patient to find if there is any blurry discoloration. Now, the next one, we have anterior chest examination. For the anterior chest examination, you need to visualize the morphology of the chest. And for the morphology of the chest, you have barrel chest that can occur in the cases of COPD patients. Now, the next thing, after the morphology, to visualize any deformity of the chest, we can also visualize if the chest is symmetrical. And the best position to visualize if the chest is symmetrical is either to locate yourself at the foot of the patient or to locate at yourself at the head of the patient. So we are going to visualize if the chest is symmetric. That is inspection. Still in inspection, you visualize if there is any scar on the chest. Inspection, you visualize if the chest is moving with respiration. So all that is seen. The next thing is to go up to palpation. So for palpation, you're going to start up with the trachea. To palpate the trachea, to find if there's any deviation of the trachea, you place your index finger on the medial side, you place your ring finger on the other side of the clavicle, and then you put your major finger on the trachea, on the tracheal prominence, direct prominence. So when you are placed on the direct prominence, just draw a straight line to find if it passes completely in between your two fingers. In this case, it passes completely in between my two fingers, so there is no deviation of the trachea. The next element on palpation is to do chest expansion. To do chest expansion, we are going to produce a crease on both chests and ask the patient, please sir, can you breathe in and breathe out? So you see the crease is, you have a crease on both sides. When you breathe in, please sir, can you breathe in? The crease both disappear, breathe out. The crease both reappears. So the chest expansion is equal on both sides. Similarly, the next element that you have to visualize is percussion of the anterior chest. This is a resonance sound. 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 But here on the left side, you may have a dull sound because of the presence of the heart. Not forgetting, every time that you percuss the chest, don't forget to percuss the supraclavicular area. So because there is the presence of the apex of the heart, and you are hearing resonance sound. The next part on palpation, or after similarly on palpation, normally before percussion, you're supposed to do a tactile phonics. Ask the patient to say 99. Please sir, can you say 99?
99.
Can you see 99?
99.
Can you see 99?
99.
Okay, so palpate, you do tactile framing to how to see if the vibration on both sides of the chest are similar. And then the last aspect is auscultation. So auscultation, you auscultate symmetrically. Please breathe in, out. Can you breathe in, out? Similarly, you auscultate comparatively on all the sides of the chest. After finishing with the anterior chest wall, we now move on to the posterior chest wall. Please, can you sit down? Thank you. So, on the posterior chest wall, you still continue with the same aspect. You have to do chest expansion. Please, can you breathe in? You have symmetric opening of the chest, expansion of the chest. The next thing is tactile framing tools. Please, can you say 99?
99.
99?
99.
99?
99.
So it is equal on both sides. The next aspect that you have to do is percussion. And all of what you are hearing is resonance sound. And don't forget that when you are percussing, your finger should tap at the level of the distal interphalangeal joint. Thank you. The last one is auscultation. You have to auscultate at the level of the back, so as similar as you have done for this other one. So from here, you have finished with the respiratory system examination.